let's go over the concept of immunity and rheumatoid arthritis. So immunity is just the body's natural or induced response to infection. Unfortunately, with this type of autoimmune disorder, your body is attacking itself. And specifically with rheumatoid arthritis, it's attacking the synovial fluid and connective tissues in the body. So the place that you'll notice it the most is in the joints, especially the hands, feet, smaller joints. Some of our risk factors include gender. Women are 3 times more likely to develop rheumatoid arthritis. The age of onset is usually between the age of 40 and 60. There is some genetic factor to it, so that can increase your risk. Smoking is a risk factor for every autoimmune disorder. It exacerbates every autoimmune disorder, so just keep that in mind whenever we're talking about autoimmune disorders. Some environmental risk factors might include air pollution or insecticides, and then there are some maybe occupational hazards like exposure to mineral oil and silica, and then obesity is a risk factor as well. So early on in this disease, you may not notice a lot of classic symptoms. They're kind of generalized. So things like low-grade temperature, which is just your body is reacting to something, a lot of fatigue, maybe some slight anemia, and then maybe some inflammation starts to form in smaller joints like in the hands. Later on in the disease, it's going to spread to other joints, and you may begin to see some deformities in joints, especially like in the fingers. You have this swan neck appearance to the fingers, and you may see the joints themselves are very inflamed and kind of like spongy feeling and painful. And you will start to see a lot more of those systemic effects, the multi-system effects of this disease. There's a great picture on page 529 in your book that goes over the whole body and what you might see. So, so things like anemia, weight loss, dry mouth, things like that. The diagnosis is going to be difficult at first because we don't see a lot of real classic things, but we're going to mostly base our diagnosis on symptoms and then correlate that with lab work. So the ESR, the erythrocyte sedimentation rate, and the C-reactive protein will be elevated, which just shows us that there's inflammation in the body. The CBC may show an elevated white blood cell count, your body's fighting. About 70% of patients are going to have a positive rheumatoid factor. They probably will have a positive ANA, which just tells us that there is an autoimmune disorder going on, so that is an anti-nuclear antibody test. And then the anti-CCP is positive in almost all patients with rheumatoid arthritis. So if you want to do a little bit of a deeper dive on some of those lab works, you can always look in our that PDF that we posted under learning materials. It goes into more detail about some of those lab works. We may do x-rays, MRIs, and ultrasounds, which would just show us maybe some of that joint inflammation and deformity. So I know the treatment, this may look a little bit intimidating, but the good news is that we've gone over almost all of these medications already. So this should be a review for you. So go back and pull out that information again because, like I said, you're going to see it again. So the NSAIDs, that was pre-work for mobility in our last module. Corticosteroids, biologics, sulfasalazine, and methotrexate, we went over that in group work when we went over ulcerative colitis and Crohn's disease. So that was Mod 2 Day 1 in the lecture materials, that nice Google Doc that you guys worked on. And gold salts and hydroxychloroquine, that is going to be your pre-work for this module. So make sure that you do that, okay? If you need to pull some of these ones out that we did on that Google Doc and write your own templates, that might be helpful so that all of that is right in front of you. And you will see it again after this. So, you know, these meds are not going away, no matter how much you might want them to. We may also do physical therapy and occupational therapy for this patient. Exercise is really important because we want to keep those joints mobile and moving. Heat and cold therapy are very good, especially moist heat penetrates deeper and faster, so that's going to help. Some surgeries that we may do a synovectomy, which is just removing part of the synovial membrane in that joint if there's a lot of inflammation there. Arthrodesis is a fusion, so they're going to lose mobility in that joint, but it may help with the pain. And then arthroplasty we've gone over already, and that is a replacement of a joint. So just make sure you're going through this stuff yourself. This is just a very small snapshot of what we're going to go over. Do your pre-work and come to class prepared to dive a little bit deeper into some of this stuff. So I will see you guys in class.